So before I go ahead and enter the patient's room, what I would do is I would check their chart. Once I have checked their chart, I would enter the room, shut the door, slide over the curtain to provide the patient with their privacy. I would perform hand hygiene, and then I can go ahead and introduce myself. So hi, I'm Miguel. I'm gonna be your nurse today. Do you mind telling me your name and date of birth?
Milton Miranda, July 22nd, 2001.
Okay, and can I see your wristband? Thank you. After using these two identifiers, we now know that we have the right patient. We also know that they know their name and date of birth. If we were doing a neuro assessment, we would go ahead and ask them if they're aware of where they are, what they're doing here, stuff like that. But he seems to know where he is, and he just seems to be alert. So now we can go ahead and let him know what we're going to be doing today. So what we're going to be doing today is we're just going to be doing an HEENT assessment on you. So we're going to be checking your head, your ears, your eyes, your nose, your throat, just stuff like that. Is that cool with you?
Yep.
Okay, awesome. So what we're going to be doing first is I'm just going to go ahead and run through his cranial nerves. I'm going to assess them. So for cranial nerve number 1, the olfactory, I'm just going to have you go ahead and smell this and tell me what you smell.
Fresh laundry.
Laundry? Okay. Alright, so cranial nerve number 1 is intact. So for 2, I'm going to have you go ahead and read those letters that are on that wall.
AZX.
Okay, awesome. Good job. Cranial nerve number 2 is intact. Next for 3, 4, and 6, we're going to be doing a few tests. So right off the bat, I'm actually going to measure your pupils real quick. So you can just go ahead and look at me. All right. Okay, so I'm gonna rate his pupils of 5 millimeters. They're equal bilaterally. They're the same shape. And right now we're gonna be doing a Perla test. So for Perla, we're checking your pupils, checking the size of them. We're seeing if they're equal. We're checking to see how they react to light, if they restrict, and we're also gonna check their accommodation. Okay. So next, what I'm going to be doing is I'm going to go ahead and cover with my hand. I'm going to not cover, but I'm going to divide his head kind of into 2, and then I'm going to introduce light from the side to one of the eyes and see if they both react equally. All right, so go ahead and look at me. All right, perfect. And both pupils do restrict equally at the same time, or they do restrict. So they're responsive to each other, equal in size. We're going to go ahead and check the other one. So go ahead, look at me. Awesome. Perfect. Very good. Next we can check the accommodation. So go ahead and stare at this finger right here, and when I tell you to go ahead and switch it up, you're going to look at the other finger, okay? Alright, switch it up. Perfect. So both eyes were able to accommodate. Now that I've found some objective, I'm going to go ahead and find some subjective information. I should have done that first, but I'm going to do it right now. So, do you wear glasses? Do you know?
No.
No glasses. Any contacts?
Nope.
Nothing like that. Do you ever have trouble seeing?
Nope.
Any trouble driving in the dark? Nothing like that. Any eye surgeries by any chance? Okay. Alright, perfect. So, I'm actually gonna check his eyes real quick too. Awesome. Very good. Okay, conjunctiva is pink, moist. I didn't see any drainage in the eyes. His eyes are white. Sclera is clear. So, he has healthy eyesight, no use of glasses, doesn't need it, and yeah. Pearl assessment, everything checks out. Pupils are 5 millimeter. The pupils restrict when light is introduced. They're able to accommodate. They're equal bilaterally. The shape of his eyes, they're both level with each other. They're equal on his face, equal bilaterally. So now we can go ahead and check the other cranial nerves. I got a little sidetrack there. Okay, So for cranial nerve number 5, what we're going to be doing is I'm just going to go ahead and I'm going to put my fingers right here on your face, and you're just going to go ahead and open your mouth. Okay, again. All right, awesome. So checking his TMJ joint. I didn't feel any cracking whatsoever when he opened it up and closed it, meaning his cranial nerve number 5 is intact. So now we can go on to 7. So for 7, I'm going to have you do this. I'm going to have you raise your eyebrows and puff out your cheeks. Okay. So when doing that, both of his eyebrows were able to raise at the same time. There was no lagging for his eyebrows. He was able to puff out his cheeks. So cranial nerve number 7 is intact as well. And for number 8, I'm going to be doing an auditory assessment. So just right behind you, I'm going to whisper something and you're going to repeat it right back, okay? Coffee.
Coffee.
Okay.
Blue.
Okay. Alright. So cranial nerve number 8 is intact as well. Next we're going to go ahead and move on to 9. I'm going to be checking his mouth too. So, for cranial nerve number 9, do you ever have any trouble swallowing?
No.
No trouble swallowing. Okay. Do you have a gag reflex or no?
I do.
Okay. Awesome. Alright, so cranial nerve number 9 is intact. For number 10, what I'm going to be checking for is I'm going to be looking inside his mouth. I'm going to be checking to see if his hard palate raises with his uvula. So I'm going to have you go ahead and look at me. Alright, open up your mouth. Say ah.
Ah.
Okay. Awesome. So uvula is present. It does raise when the patient says ah. Hard palate does as well. And I'm going to go ahead and actually check his mouth right now. So starting off with some subjective questions, have you ever had any work done on your mouth? Any braces?
No.
No braces. Okay. Any surgeries in your mouth?
No.
Do you have wisdom teeth?
I got them removed.
You got them removed?
Yeah.
Okay. Perfect. What about, have you gotten your tonsils removed?
No.
No. Okay. Very cool. So if you don't mind going ahead and saying okay. Alright. Very cool. Go ahead. Shut your mouth. So right off the bat, the lips are pink, moist. I don't see any lesions around his mouth. No abnormalities. Inside the mucosa is present as well. The gums look healthy. All teeth are present. I don't see him missing any. Like I said, uvula is also present. Yes. I feel like I'm forgetting something, but never mind. Okay. So you were able to say, so 9 and 10 are intact. For number 11, I'm just going to have you go ahead and shrug. Shrug. Okay. So 11 is intact, and for 12, go ahead and say off, or just go ahead and stick your tongue out. Oh, okay, good. So cranial nerves 1 through 12 are all intact. And we've also performed an assessment on his eyes, his mouth. Now we're actually going to go ahead and check on his head. So looking at your head, right off the bat, his entire head really looks equal bilaterally. I don't see any patches in his hair. He's got a healthy scalp. I'm going to go ahead and palpate it. I'm feeling for any lesions. No masses. Okay. Okay. Good. Alright. Just looking at his head, his face is equal bilaterally. His ears also, they're at the same, that's the same, do you mind looking at me actually real quick? Alright. His eyes are actually at the same level as his ears, which is I think what we're looking for. Scalp is freely movable. Have you ever had any brain injuries or anything?
No.
No? Okay. No concussions, anything like that? No surgeries on your head?
No.
Okay. Alright, so what we can do right now is, I'm going to check your range of motion, so if you don't mind looking to the left. Okay. Alright, to the right. Up. Down. Okay. Good. Did you feel any pain when doing that?
No.
Okay. Have you felt any pain whatsoever, like throughout our entire assessment? Okay. All right. So if you do feel any, just let me know. All right. So what I'm gonna be doing right now is I'm gonna go ahead and check for his lymphocytes. I'm looking for any lymphedema, any swelling, any masses. Hopefully we don't find any. So what I'm going to be doing right now is I'm actually going to start at the preauricular, all right, postauricular, occipital, tonsillar, submandibular, submental, all right, superficial cervical, deep cervical, okay, supraclavicular, all right, and posterior cervical. All right. I didn't feel any lymphedema, no masses. I didn't feel any tenderness either when I was feeling his head. When I was checking his lymphocytes, I didn't feel anything, which is what we're looking for. So everything checks out there. Next, what I'm going to be doing is I'm going to go ahead and check your nose real quick, okay? For your nose, do you have any allergies?
No.
No allergies. Okay. Do you ever have trouble breathing? No trouble breathing. Do you ever feel any drainage, like you got a runny nose, like really bad? No, nothing. Okay. All right. So patient denies any drainage, any leaking from his nose. I should note actually that when I was examining his eyes, there was no drainage either. So I'm going to go ahead and check his nose. So I'm going to start by palpating your frontal and maxillary, all right, on his nose. I'm looking for any tenderness, any masses. Okay. Do you feel any pain when I do this? Okay. But you do have feeling, right? Okay. So patient is able to feel while I palpate him, and he does not. There's no grimacing on his face. He denies pain. So I'm gonna go ahead and look inside of his nose. All right. Your nose.
Sorry, there.
No, go ahead and look up. All right. Okay. All right. So while looking inside his nose, I don't see any drainage. I don't see any foreign bodies either. I see a septum with no perforations, which is good. We don't want any holes in that septum. Hair is present. The flesh inside is pink and moist. I didn't see any lesions or masses inside his nose either. Okay. Alrighty. And the nares are equal bilaterally. Okay, perfect. So now for the last part of our assessment, we're going to go ahead and check inside his ears. So to check inside of the patient's ears, what we're going to be doing is, first I'm actually going to go ahead and look inside them. Cerumen is present in both ears. Here, I'm actually going to pull this back. Awesome. And what I just did, I just grabbed the tragus, pulled it back a little bit to get a better view inside. There were no foreign bodies. Hair was present. There were no masses inside of his ears. Cerumen was present, no drainage. Do you ever have any trouble hearing?
No.
No. Do you use hearing aids or any other devices to help you hear? Okay. And you said you never have trouble hearing.
Yeah.
You never have it. Okay. All right. So, just to recap, cranial nerves 1 through 12, they are present. They are intact. The patient denies any pain whatsoever. No drainage when I was checking his ears, his nose, his eyes. No lesions, no masses on his scalp, on his lymph sites. Nothing of the sort. And that would be the conclusion for our HEENT test. So.